Pharmacy Friends brings industry experts to the same table to talk about what's happening in pharmacy today, what's coming, and most importantly, what it means to you. We explore and share pharmacy trends stemming from the evolving healthcare market, where advancements, policy changes, and technical advancements make a difference. As we've noted, AMCP's mission is to enhance the quality and affordability of healthcare. Prime MRX is also focused on this mission, which is even more crucial when you consider a key category driving healthcare spend today is high-cost medications called specialty drugs, which are used to treat several severe diseases and conditions. We caught up with Kristen Reimers, Senior Vice President of Specialty Clinical Solutions at Prime MRX, to talk about some of the presentations at AMCP that touch on this important business segment. Well, so Kristen, thank you for joining us today. It's a pleasure to have you, and obviously AMCP is a big deal. How's it been for you so far?
Oh my gosh, there's so much excitement in the air. It's palpable, really. And the spring meeting is always a great start to the year. Everyone's excited, and there's not only an amazing educational agenda and sessions that you can go to, but there's really great panels where you have industry leaders talking about, the things that they're experiencing and their issues and concerns, and you have an opportunity to speak with them and network with them, even talk to the people next to you as you're sitting through the sessions. So it's always a great time to meet new friends, get new contacts within the overall industry, and then catch up with longtime colleagues and see what they're up to and the changes in their careers. And then, there's really a palpable buzz in the air when you go down to the exhibit hall and see all of the amazing posters that are down there and the exhibitors and the things that are happening within our industry. So it's been a great experience so far here in New Orleans.
It's a great show. A lot of good energy. So tell us a little bit about how Specialty Clinical Solutions is connected to the AMCP presentation sessions this year.
Yeah, we have 3 really unique presentations that we submitted to AMCP, and the educational panel selected them. Obviously, these were in line with some of the objectives of this year's meeting. And the first one is on drug wastage and eliminating drug wastage. It's in collaboration with one of our health plan partners, Horizon Blue Cross Blue Shield of New Jersey, and it really talks about unique strategies that can be put in place and really make a difference in eliminating drug wastage and improving overall healthcare affordability for members. The second is really a thought-provoking session on management strategies for cell and gene therapies. These are some of the most costly therapies in the market today, oftentimes over $1 million on an annual basis for these types of therapies for very rare disease states where there have not been overall management strategies available. So this ensures that the right patients are having access to these therapies when they need to. We talk about management strategies for some of these, as well as figuring out how are we going to pay for these therapies as an overall healthcare industry and make sure that we're able to get these right therapies to treat these very rare disease states to members when they need them. And then the third session is we are participating in a panel on interchangeable biosimilars and the difference in the impact that these biosimilars have made. And we've seen tremendous impacts of the biosimilars in the oncology space for infused oncology therapies. And then adding the fact that there's interchangeable biosimilars for things like insulin and the autoimmune drugs like Humira, they're really making a big difference. So talking about patient advocacy as well as the availability of these products, and then providing other options for members that are more cost effective for them.
So how are these topics decided, and what are some of the impacts?
Yeah, these are really meaningful examples. All 3 of those sessions are meaningful examples of how member access and affordability can really be impacted by certain strategies, putting those strategies in place and considering the overall clinical outcomes for the members, as well as the most cost-effective therapies and overall lowering costs for members.
So what are some of the up-and-coming topics that are important to the future of specialty management?
Yeah, that's a great question. So we are really looking at specialty drugs across the pharmacy benefit, those that are self-administered, as well as the medical benefit, those are that are health plan administered, and being able to look at those in a holistic approach from a member perspective, overall therapies, and ensuring that those members are getting the best quality health care that they absolutely can. We're looking at data and incorporating historical data with forecasting tools and the new drugs that are coming out on the pipeline. There's practically a new drug that gets approved almost every month. That is a specialty drug. These are extremely high-cost drugs. So using these forecasting tools to mold strategies to create unique for health plans is extremely helpful to have those impacts, like our drug wastage program, that really help make a difference for affordability for drugs. And then another really hot topic is regulatory right now. So the regulators and the lawmakers are really focused in on things that are happening in healthcare and overall healthcare affordability for drugs for members. And I think working with organizations like AMCP and others and helping to educate those lawmakers in terms of the downstream effects to both providers and members makes such a big difference. So that's a really huge topic, understanding the regulations that are being contemplated that are out there and affecting our overall industry. And then central to everything is really member care. That is at the heart at absolutely everything that we do, and so vitally important. So breaking down the social determinants of health and the barriers to access, and paramount to absolutely everything is really improving affordability for our members.
So I have one last question for you.
Sure.
This is not prepared, but it's in the spirit of the show and, of course, our host city, New Orleans. So we're asking guests questions to see what they know about the Big Easy. And so here is your question. The Sazerac was named the official cocktail of New Orleans in 2008. It's a close relative of the Old Fashioned, and it contains rye whiskey or brandy, bitters, sugar, and this unique spirit. What is it?
I have no idea. I'm going to guess Aperol.
You are very close. Absinthe.
Oh, wow. Okay.
Yeah. So maybe that's something to try while you're here.
Yeah. All right. Well, thanks for the tip.
Thank you for joining us today, Kristen. Really appreciate your time.
Thank you.